is not justified. A new Medicare proposal might change treatments for patients who are missing limbs. Tonight, members of an amputee support group gathered. KOMU-8's Andria Kirkland looked at the possible changes.
Medicare's local coverage determination proposal, if approved, could raise the requirements to obtain advanced prosthetics, limit the role of prosthetic designers and manufacturers, and reduce the variety of prosthetics offered. Tracy L. is a certified prosthetist and owner of Mid-Missouri Orthotics and Prosthetics. As someone who works to match patients with products, he said he is concerned about the effect on treatment for people with missing limbs. Patients will not be able to achieve the outcomes that they received previously. Their mobility will be restricted, and all the things we try to do to restore and rehabilitate will be affected. Burris said he believes the proposal could prevent people from getting the care they need. Currently, there are 150,000 amputees in the Medicare system that could be impacted. Some people are worried more than 2 million could be affected if the U.S. Department of Veterans Affairs and private insurers follow Medicare's lead. Dr. Joseph Burris, the Director of Amputee Rehabilitation Services at the Rusk Rehabilitation Center, said problems in the system helped prompt the proposal.
The government has investigated, and they found evidence of significant fraud and abuse in the area of durable medical equipment and in the area of prosthetic and orthotic devices. With that history, they have developed more restrictions.
But Burris says although he understands why these restrictions are being considered, it is important to keep patients' needs in the forefront.
I think this is an important issue for a growing number of patients. If you look at statistical data, the incidence of lower limb amputation is supposed to double between the late 90s and 2030. And so there are more and more people, not only in Missouri, that are going to be suffering the consequences of amputation, but across the nation. And we need to be able to appropriately evaluate and treat patients.
Andria Kirkland, KOMU-8 News, Columbia.
A petition asking the White House to rescind the Medicare proposal has more than 100,000 signatures.